Growing up, I always wanted to be a scientist. I found it fascinating to study things and learn more about the world. And I realized that I could become a physician and study science and practice medicine and form close relationships with other people. And that allows me to, in my current position, do both. I am both a researcher and a surgeon. I'm Mark Etherington. I'm a gastrointestinal and hepatopancreatobiliary surgeon here at Penn Medicine. Within the field of surgical oncology, I actually even specifically focus on tumors and benign conditions of basically the upper abdomen, the stomach, the small intestine, the liver, the pancreas, the bile ducts, and the gallbladder. The anatomy is fascinating and some of the most complicated things in the human body. The diseases are challenging and therefore inspire me to work towards defeating them. It's a very vulnerable time for somebody. One of my first goals is to provide reassurance and comfort because no matter what the spectrum of their disease is, I usually have something to offer. The goal is to be able to offer an operation to remove the cancer if it is indeed a cancer. Even if it's not, I can usually provide guidance and reassurance and input for a patient. One of the newer techniques that we're offering here at Penn is robotic pancreas and liver surgery, and that allows us to perform more highly technical operations such as the Whipple operation using a robot, which means smaller incisions for patients. It may not be relevant for every single person, it may not be practical for every person, but it's my job to identify who could undergo that, and that's something we offer. At Penn Medicine, you really get the full package. You get specialists of all facets of oncology that are world-class. Not just surgical oncology, but also in the medical oncology where we have colleagues who are leading pivotal clinical trials, to the research side of things, which we work closely with and try to bring their discoveries to the clinical realm. We frequently have our pathologists render a more sophisticated diagnosis, and same goes with radiologists. They find things that others don't. The best part is seeing a patient in the post-op visit who has successfully and safely undergone a surgery, possibly with little to no incisions, and we got their whole tumor out and they feel that they have a new lease on life and they're ready for the next steps.